welcome back. We will start our last session. Please take a seat. So we have now a very interesting session to showcase four concrete business opportunities you will have this year in Europe and more precisely in Spain, because we have four speakers from Spain, from Catalonia, but as well from Extremadura in the south of Spain. And the idea of this session was to show you a few opportunities illustrated before in the framework of the Next Generation EU. We talked about this massive investment from the European Commission, from the European member states, from the European regions on innovation, on digital health solutions, whether we are talking about public purchase for innovation, and the first speaker will talk about this kind of scheme of investment, or if we are speaking about classic public purchase for a solution that will be implemented in routine in the healthcare system. So the idea was to showcase a few opportunities to show what kind of project we can participate in with this funding, what kind of solutions are requested by the governments. And this is only, I repeat it, a few samples of the massive investment that will happen in Europe. We talk about more than 700 billion invested in the next years in Europe. A big part of that will be dedicated to health and digital health in particular. So, as we said, ECHAlliance is trying to help its member, its community to understand what is happening, where it's happening, what kind of solutions are targeted, and what kind of opportunities you can have as a company. So, to start with this session, last session, I'm very pleased to welcome Jonathan Gomez-Raja. Jonathan is working for the region. We can applaud Jonathan. Jonathan is working for the region of Extremadura. You have plenty of diploma, so I won't of degrees, so I won't mention everything. But he has a PhD in biochemistry. He worked as well in research in bioinformatics. Knows Alfonso, who was presenting before. You have as well huge experience in management of R&D project and research project, and you're coming today to as representative and chief research officer of the Fund de Salud, an organization, and you will tell us, from the government in Extremadura, a region in the west of Spain, close to Portugal. And you will explain how the project you are developing at the moment. Jonathan, the floor is yours.
Thank you, Julian. Thank you to the ECHAlliance for the invitation. So my name is Jonathan, and I belong to the research foundation depending on the government of Extremadura, which is managing all the research and innovation programs in the healthcare system in Extremadura. So the healthcare system involves 14 different hospitals, more than 500 primary care centers, and everything is centralized in the same healthcare information system. So this provide us a really good environment and data environment to exploit that data. But as you saw already with Alfonso, so it's a tricky thing, so it's not really easy to exploit, to take advantage of the huge amount of data we have, because we involve, not only medical records, also procurements and contracts, waiting list, images, lab tests, everything is in the same platform. But it's really, really difficult to exploit that data. What I bring here, if you pass my presentation, Julian, or should I? Okay, should I? Yeah. What I bring here, it's one project we are involved. It's a Horizon 2020 project, which is really focused on treatment of chronic diseases in the rural areas. So the project involves 7 partners from 3 regions around Europe. So this is a PCP project. It's a pre-commercial procurement project that will publish tenders for those you guys are companies and probably are interested in provide solutions to this challenge. So the 3 different procurers, the 3 different regions that are going to publish tenders are Extremadura, my region in Spain, Västerbotten in Sweden, and Agder in Norway. So these are the three procurers. Will be a procurement for the three different regions, and we are validating the solutions in real environments. So basically, this project comes from the real problem we have of aging, and it's estimated that in 2050 we'll have more than 30% of the population older than 65 years old. But also we have a problem about dispersion of population. Extremadura in my region is one of the regions that are facing that problem. So all the young people are going to Madrid, going to Barcelona, are going to Basque Country. So, and we have increase in all over the year the population that are older. Older means also chronic diseases, comorbidities, more treatments, polymedication. So, and we need to have new tools, new solutions to face that problem, to find that problem. So basically, rural areas, only 20% of the population are completely covered by the healthcare system, and we have to transit to move from the model usually we have now to the model that 80% of the population should self-manage their own diseases, their own chronic problems, and also 30% of the Europeans live alone, older than 65 years old, live alone. All the people in general live alone. So our solution we plan in this European project is based on two pillars. One, which is the healthcare from home, involving data lakes and technology, trending technologies, in order to provide a model for self-management, so monitoring people at home and so on, which means, what you already know about the telemonitoring people or telemedicine or whatever you can call it. And also all the ecosystem around the patient, not only the healthcare system, also the local communities, the municipalities, the social care system as well, integrated care, probably you've heard about the integrated care so many, many times, and also the innovation industry around. So, and for ecosystem of well-being, we have different providers, not only the purely healthcare system. We will end up in the crane integrated model for self-care based in these two pillars. And also the solution should be based on five building blocks, 5 different building blocks. Data governance, and we already heard in this, also on this stage about data all over around. So our model will be based in providing and to collecting and gathering data from the public system, but also from the private system, available in solutions like the My Health Enabler, and also automatic and secure anonymization and encryption of the data, artificial intelligence for sure, and then provide a feedback to the users or feedback to the healthcare providers. So everything based in a consent, consent document, in a consent, informed consent model that the user or the public and private entities will provide data to the system. So the data can be from the public, from the private, data from registries, and also genome data. Everything will be gathered, analyzed, and using artificial intelligence, we will provide feedback to either citizens, for sure, auto feedback, healthcare providers, to see processes and so on, and also to the private sector, to vendors, to pharma industry, to insurance companies, and so on. everything should be based on trend technologies, wearables all around, so all kind of wearables we already have, and all innovative that will come as well. They have to be interoperable each other, and everything in the we call garden of care. So not only the hospital, also the pharmacy, also the municipality, also the emergency system, the palliative care, the home care, and the community support, all around the patient. With the final aim of the people matters. So the people should control their own health through motivation, through engaging, through stimulation, and finally to have a model which is value-based. So we need to provide measurable indicators and evidence of the cost effectiveness of these kind of services. For those who don't know what is a PCP project, a pre-commercial procurement project, what we have now, it's the industry stakeholders will have interaction with the public administration through different events, matchmaking, interviews, questionnaires, and so on. And the phases we will have will be the phase one, which is the solution design, where several different providers will provide through a tender what the solution they want to achieve, they want to provide. The phase two prototype development, where we can have less providers. And the phase three will be the validation in real environments, and we will use Extremadura, Adger, and Boston. The phase four will be the scale-up, and this is not provided by the project, but the idea is if after the validation the solution works, for sure, the administration will be interested in scaling it up. But either way, we have another instrument, PPI, which is another public procurement that will cover that phase. These are the timeline. In August, we are publishing the call for tender, so I really encourage you to follow the project for those that might provide solutions. In February 2023, we have the final decision solution. In 2024, by the end of 2024, we will have the first prototype, and we validated for almost 2 years, and we will have the final prototype validated in April 2026. So in the end, the CRANE project will improve life quality of chronic patients, optimize the use of health and care resources. We will provide lower need of hospitalization and emergency assistance, reinforce the social network and favor seniors' mental health, improve the health and delay the appearance of chronic diseases, and for sure engage the local communities and industrial partners around. This is the CRANE vision we envision from the beginning of the project. We are working this project for 6 months already. So this solution will be for the citizens, enabling through public and private data access for those that are in risk of chronic condition, probably not for those that are having chronic diseases already, probably for those that are in risk to have chronic conditions and requires action. I want to self-manage and improve the management of their health condition using their own data, because in the end, the patient is the owner of the data. So what we want to remove all the silos we have in data. We already have different talks about, the hospital has their own silo, the healthcare provider in another place, in another country have their own data, and we are not exchanging data. So the idea of this project is trying to remove all the silos and provide the citizen with an open, trustworthy control of their own data and the use of data. So this is the project website, and you can follow us on Twitter as well, and you have my contact details also in my email below. So I will be very happy to keep in contact. Thank you very much.
Thank you very much, Jonathan. You can stay on stage and take a seat. After the presentation, we will take a few questions. Thank you very much for this very clear presentation. I'm pleased now to welcome Joan Guanyabens on stage. Joan, and we can applaud Joan. Joan is well known in Catalonia, having worked many years at the Department of Health here in Catalonia, managing different part of this Department of Health, consultant, very experienced in digital health and digitalization, digital transformation of healthcare, and now consultant. And you are presenting today Criticat with a very interesting project on ICUs and emergency services in Catalonia. So, Joan, the floor is yours.
Good afternoon, everybody. Thank you for the invitation. And I am here to present this project. It's the Criticat project. And the objective is to integrate all the information that we generate in the ICU units of the Catalan hospitals. What we want is to allow the management and the optimization of these critical resources. Integrating clinical information and creating a command center is the final objective, the final result that we want to achieve. We want to optimize the healthcare management and the ICU of the Catalan health system, and the objective, apart from global modernization and digitization, is mainly the link, the integration of information of all these areas, all of these units. Currently, the ICU units of the Catalan health system have different information systems, but these systems are not normalized or integrated and don't allow monitoring of the activity and optimization of these resources. So at the end, what we want is to integrate the information of all the continuous monitoring of these beds, of these units, of these through the devices. Also, we want to have a global vision of the healthcare as an integrated, interconnected ICU system. And what is important is that we want to allow to share knowledge between the professionals of the critical care units that could analyze, could exploit, evaluate, and also establish protocols. That's important. At the end, what we want is to facilitate the decision making in terms of systemic and structural decisions. Another important point is to allow the remote control of a specific patient from less complex centers from other centers. So this interconnectivity between centers is also important to activate these kind of solutions in specific situations. If we integrate all the clinical information, all the clinical data, all the continuous monitoring of the activity of these resources and also the clinical information, what we can also achieve is try to develop and try to apply new algorithms based on artificial intelligence. So what we want is to facilitate all this information integrated to the development, to the design and development of these predictive and models and artificial intelligence. Nowadays, we have 44 units, critical care units in Catalonia, and around 900 beds. But in the pandemic situation, we reached 2,000 beds for all the system. So this is the objective, to be prepared to integrate and to manage this kind of resources from Catalonia. Well, these are the main areas that we want to develop and we want to contract, and we have to develop in the next month. In the first step is to have a project management office to manage all these projects. Also, what we want is to equip all the beds, all the critical beds, with the equipment that allows this continuous monitoring. So we have to also procure this kind of equipment. Then we have to see how we concentrate all this data, all this continuous monitoring in a unique hub, in a unique central part. And also we have to review and to facilitate the departmental information system for the intensive care units. So we have to guarantee that all the hospitals has information system, a departmental information system for manage their critical beds. At the end, we have the command center, so this global view, this integration of all this information for management and optimization, and also, as I comment, we want to facilitate and to start and to develop the algorithm, the artificial intelligence that the professionals of these areas need to automatize and to improve this management. Well, we have, from the REACT funds, we have 53 million euros, and the deadline for these resources is the end of 2023. So we have a very short time to do all these tasks that I review and I mentioned. These funds must to be dedicated to equipment and also to services, but not for personnel and not for the physical space, for instance, for the command center. This is a big project, a short project that we have to deploy in the next month. We have worked together, of course, with the intensive care professionals, and it's a project promoted by the health department, and the governance of this project is managed by the Catalan Health Service. So the Public Health Insurance of Catalonia is who has the responsibility to manage and to control this project. Of course, we will habilitate an expert advisory committee coming from the Catalan Society of Intensive Care, coming from the professionals, and also we have to work together with all the healthcare providers from the Catalan system, from the different providers, and also the medical emergency system will play an important role also in the deployment of the project and in the new situation that we want to achieve at the end of 2023. Thank you.
Thank you very much. Thank you, Joan. Please take a seat. Thank you very much. We will take a few questions. Big project in 2 years, very ambitious. Big challenge here. I'm pleased now to welcome Tony Massey. Yeah. So Tony is, it's not for me, I think. Tony is Chief Information Officer at the Blood and Tissue Bank here in Catalonia, and you will present us a very interesting project for this year and the following. Please, okay. Tony.
Thank you very much. Good afternoon. I'm going to explain our project. It's a digital transformation from the blood process. First of all, I want to explain who we are. We are the Blood and the Tissue Bank here in Barcelona, here in Catalonia. And we are a public agency from the health department. And our mission is to guarantee the supply of the blue bags here in Catalonia. We are present in 14 hospitals in Catalonia, and we collect all the donations from the 100% of the collections in Catalonia. We receive all the bags. And also, we are present in 14 hospitals, and we manage approximately the 70% of the bags for transfusion for patients. Our model is the model vein to vein, from the vein of the donor, to the vein to the patient. At this moment, we are collect approximately 280 bags, 280,000 bags a year of the donations in Catalonia, and more or less 1,000 units bags daily to transfusion to the hospitals. Okay, now this is the situation and why we are doing this project to digital transformation, because our current situation is we have multiple system information. We are not really connected with the system information of the health department, and we are limited with actual supplier the evolution of our system. So we need to transform the company, we need to transform our system informations. So we need to go to a new project to give us a vision, 360 vision of all the process. We need to create a common model, which that all our people we need to work at the same way. So that is very important for us. Also, standard process. We need to connect with the health department and system information in real time. For us, that is very important. And also, we want to explode and analyze the data with a big data. So these are our goals, and for these reasons, we need to create this project. This is our current situation that we are. This is all the process from donation to the transfusion to our patients. We are multiple systems. We are manual entries. We have a lot of Excels, so multiple system informations. All the process is fragmented, so our users doesn't work correctly because it's very difficult to analyze the data and also to do the process. So for that reasons, we need to transform all of this with a new development, a new project to transform all of this. We have the same scheduled date that Criticat, because this project is financed by React funds. So at the end of 23, we have to end this project. So we have to start several projects in parallel. First of all, we have to develop a new platform to cover the process from donation to transfusion to our patients. All unique system information, end-to-end or vein-to-vein. Also, we need to adapt and modify our system information CRM to this system information we use to contact with our donors. Also, we need to adapt some SAP system information to inventory and billing and integrations, some integrations. We need to create a new data warehouse to collect all the data in this new platform and create new big data, new artificial intelligence, and new algorithms to be more efficient. And also, we need a project office to give us support because so many projects in parallel working with this scheduled date. This is the new photo. Our objective, our goal is only one big platform that cover all the process from the donor to the patient, and this platform integrated in real time to the electronic health system, because for us this will be an add-on that electronic health system. So we need to send and receive the information in real time. And it's our project, and our benefits to develop these projects is develop our own solution, no license cost, no problems with integrations, because at this moment we have a lot of problems with integrated data with another system's informations. Integrate our platform with the electronic health record. Also give us evolution capacity to create and to improve our process. We will work with a new technology. We will standard our process and will be more efficient. And also, can we apply artificial intelligence or big data inside the process? So with these React phones, we want to do a full digital transformation of the Blue Bank here in Catalonia. Thank you very much.
Thank you very much, Tony. Please, no. Thank you very much for this presentation. Again, we will take some questions after. I'm very pleased to welcome Dr. Marco Incitari. He's Director of Integrated Care and Research at Parc Sanitari Pere Virgili here in Catalonia. Marco is a medical doctor, PhD, specialist of geriatrics. Actually, you're the current president of the society, the Catalan Society of Geriatry and Gerontology. And you will present us a very interesting program that you're developing here with your international background in parallel of that. And you will explain us what kind of project you would like to develop today.
Thank you so much, and thank you for the invitation. It's a pleasure to be here, and I would like to share this project that it's also competing for React next generation funds. I have to state before starting the presentation that we have not been given the final confirmation of the funding yet, but we hope it will be possible in the next time, in the next days or weeks. So before starting with the presentation, I'd like to ask you a question, since you have been so quiet until now. And the question is, where do you like to grow old? Where do you like to grow old? A home, not in a nursing home, right? Not in a hospital, right? Okay. That's an obvious but very common answer. There are many surveys from the US, from Spain, that show that older persons or young person as well want to age at home and be at home as long as possible, possibly until the end of their life. So this is what we aim with this project. This project, it's called Admit COVID-19, so it means home-based integrated care, so atención domiciliaria integrada COVID-19. And this is the primary aim. The primary aim is to allow older adults with COVID consequences, but as an indirect benefit also other older adults with complex health and social care needs to stay home as long as possible during the year. Of course, with a good quality of life. So this is a project of integrated care, transformative and technology-based care. We have to say that the project combines two, let's say, global aspects. One, the first one and the most important one, is the operationalization of a new integrated care model between healthcare and social care. So we want to change the way of working, training, and support to the person and their caregivers. But as a facilitator to this new model, there is also the technological component. So we need new technological projects, digital projects, that I will go a bit more in detail in the next few slides to give support to this change of the operational model. The project, of course, aims to have an impact to different challenges. The first one is the COVID-19 situation. Of course, you know that in older population have been receiving the majority of the negative consequences of COVID-19, not only in terms of mortality, mainly during the first wave, but also reduced social contacts, reduced quality of life, more disability, and also the healthcare system and the social system has been more looking at the COVID-19, tracking the contacts and everything, than following up, for example, chronic patients. So aging, chronic disease and disability in the Catalan population, but also in the Spanish population, in the European population, is a big challenge. There is a fragmented social and health care, so we want also to respond to this. There is one aspect that is not very commonly perceived and managed, which is the status of the caregiver. So very often we have caregivers besides the person with complex chronic health and social needs, and we don't give a role to them. So we need to improve their status, we need to train them, we need to improve their jobs and so on. And then, of course, there is economic sustainability of the welfare system. So there are two main parts, as I was saying. The first one is the care model. So you can see on the left part of the slide that this model is directed mainly to older adults with chronic consequences of COVID-19, but also with complex health and social problems. And there are some labels that help us to detect these kind of problems. So advanced chronic diseases, terminal diseases, advanced disability, and so on. We will have two main care pathways. So we want to tackle people that are already at home and keep them home as long as possible. Of course, if they need to be admitted to a hospital, it's fine if they really need it. But this admission has to be very targeted and short in time. But also, we want to target older persons that are in the hospital, intermediate care or acute hospital, and they need, let's say, a safe transition home. It's very frequent that people at the discharge, at the moment of the discharge, they experience new problems, different functional situations, so they are readmitted in a very short time, and we want to avoid that. Our care model is based on the comprehensive geriatric assessment, so a common assessment between the health and the social resources to have a final individualized care plan, and of course, a timal activation of resources to keep the person home. So social support at home, support products, and so on. We also want to scale up a program directed to focus and to implement healthy aging and prevent disability that we already have in one area of Barcelona. That's the Agile Barcelona program. That's based on physical exercise, good nutrition, social relations, and so on. So we want to scale it up in different territories of Catalonia, and all this with a co-creation approach. Okay, so this is, for example, one of the examples of the definition of each actor role in the new project. The technological solution is based on different solutions. The main one is a digital platform, which is accessible by the user and the family, is accessible by the caregiver and by the healthcare and social professional. So the idea is that the caregiver with a person can, let's say, bring data and have a day-by-day check of their health status, not only vital constant, but meaningful variables for the geriatric care and the gerontological care. And this can be seen by the professional to take decisions. Other data will be added by sensors at home, a small pilot with robots, okay? And all this will nourish smart algorithms to help and support the decisions of the healthcare professionals. We want to build all this with a co-creation approach. So in parallel, we are launching an aging living lab, which we hope will help us to refine the care model with the participation of end users, caregivers, industry, research, and administrations. And all this model will be, let's say, will land with this co-design because they will shorten the gap between the solution we have and the implementation. We have a lot of work already done, and we want to implement this in 3 territories of Catalonia: Barcelona, La Garrotxa, and Tarragona. We target, let's say, 1,500 users. Of course, this will depend on our final deadline, okay, and the time we have in front of us. But there's an ambition, of course, implementation. And we already had a lot of work done between all these partners. We want also to produce evidence in a AAA at least. So benefits on healthcare, quality of life, but also people experience and costs, okay? So, of course, we were prioritized by the Catalan government, and we launched some months ago, I would say, a request for information to the market. So we had different companies that responded to the request for information. If I remember, it was like 7 companies or consortiums. This is public, okay, on the website of the Catalan government. And, of course, there are solutions in the market, which is good. Also solutions with limitations, because, for example, one of the limitations we found is that many solutions are directed towards one specific chronic disease. And here we are targeting a complex, let's say, framework of interaction of health and social problems. So the specific solution that will, for example, be used for telemonitoring of vital constant for a specific chronic disease probably won't be such a good fit for such a complex challenge. And this was one of the limitations, but there is a public report. So I would really thank so much the team that has been working very hardly to this project since months ago. This is my institution. That's a public company in Catalonia by the Catalan health government. It's Public Parc Sanitari per Virgili, providing geriatric, palliative care, and primary care. And we hope to have good news soon to implement this ambitious project. Thank you so much.
Marco, please take my seat. Thank you very much for this very clear presentation. 4 very interesting projects and opportunities for you guys. Do you have some questions? No? We have a question, yeah. So please. Microphone. I don't know if we have somebody. Here. If you can say your name and organization, please.
Yeah, sure. I'm Ferran from Alma Medical. I have a question to Marco. It's just, in your presentation, you just said there's 2 key problems. One is that caregivers are, it's a guild that it's with a low social status, they're looking for training, but I didn't see anything to focus on this problem in your project. And also in terms of scalability, it's just as all the devices and everything you could put in at home, it's expensive. How you standardize and decided this as people, it's getting old and the group of persons are getting old, it's getting bigger. How is the government fix this?
Okay. Thank you so much. Of course, that was a broad presentation, so I didn't go into all the details. And second, a part of the answer to your questions, we hope it will come from the public tender, because we will have to launch a public procurement for innovation. So part of the answers we hope that the market will bring the answer to us. But in general, of course, we know, for example, that the caregivers are young people. They have access to mobile technology. So we want to take advantage of this. And of course, this can be a mean to build a platform and also a platform aimed to train them and to connect them between them. So these are things that we hope that the solution will provide, among others. Okay? So we have some specific things that we want, and this will be public in the tender, of course. But we think that this is a key target user, exactly for what you said. I mean, many of the people are older people. There is an important digital divide still today with these older people of 80 plus years old. So we think that the family or the professional caregiver can be a reference person also with technology and for the follow-up of these people. Then for the second question, of course, there are the costs, and you are perfectly right. Of course, older people are also in general tend to be more disadvantaged people, so the access to technology is reduced. And of course, there is a problem of more than a scalability within the project. We are very concerned about the scalability beyond the project. So how all these cost of licenses and everything can be sustained afterwards. So we also hope to have a positive answer in terms of, for example, license of a project for the public system, healthcare and social system in Catalonia, at least to have the ability of maintaining the solution for a period beyond the project, but we hope that it's legally possible. I don't know if...
Okay, hope you heard the answer with the music. Do we have other questions? Yeah, we have a couple here at the beginning, and then gentleman here. Here. Sorry for the noise.
It's for Tony Massey. Well, I'm Mireia Martinez from Park Sanitary Virgili. I don't know if you explained it, but you said that you will use artificial intelligence for all your projects. Can you go into more detail how and how will you use it?
Yes. We need to collect all the data in a big data, and with an artificial intelligence, we want to manage in best way the stock, for example, where we have to go to ship the bags in order to the due date or in order to the capacity of every hospital. So with artificial intelligence, we need to analyze in which hospitals needs with kind of type of blue bank needs. So now we want to analyze this data and explore these algorithms to ship these bags to the centers, to the hospitals. Okay.
Thank you. Mr.
Hello.
Yeah.
You have been talking about those amazing projects that include high technology like artificial intelligence and robotics and all that issues. And I think the risk in that cases is to be so far away from the people, because that is an important thing in systems and everything, to be to the people to be able to manage all this and to be engaged with all the processes in the systems implementations. How do you plan to deal with that issue?
That's for me? Or
To any of
for
you.
everyone?
Up to you.
Well, in the project, one of the activities we already have done, and also it's planned through the project, is to have some workshops with users. So it's typical for a co-design project. When you are designing a new solution or something, you have to take care about the user. We already developed some workshops, interviews, and other focus groups, and so on, for both users as a patient, a user as a healthcare professional. So we gathered all this, and when we publish a tender, we take into consideration those needs, those views, and everything like that. I agree with you. Sometimes we are going further and we are developing something which is really far away from the users. But during the project, we need to have the user's view and also to advance also in the trend technologies, because we need to provide new solutions to change the paradigm, to change the system in order to, for in my case, chronic diseases, so it's not sustainable anymore with the current model of health and care system. So, but we take care of the users.
Cool.
Very briefly, I think there are two main issues in our project that answer your question. The first one is that at the first point we put the transformation of the care model before technology. So it's to reshape how the professional attend the person and how they empower the person and the caregiver. So this is one thing, which is not only the technology. And the second one, which I put at the end, everything we do, we want to do with a co-creation approach. And this is why we want to implement this living lab that we hope will go beyond this project. And of course, we want to engage more institutions and companies if possible. But we will do all this, and we already have started to do this, to engage professional, user, caregivers, and so on, to let us know how they want this provision of technology.
Thank you. Tony, Joan, okay. We have another question.
Hi, my name's Justin Anderson. It's a question for Jonathan. Actually, it's a question for all, but aimed at Jonathan because he used the word interoperability, which, if we look at the scale of the challenge, there are a number of different data sets, different data types, systems that we've got to bring together, integrate and consolidate. Interoperability is going to be a critical facet. Obviously, there are standards out there. FHIR have been developing their standards for the last few years. They seem to have stopped about 18 months ago for some reason or another. I'm assuming that FHIR is probably a key standard that you're using in interoperability, but how are you going to solve this problem across your project? Have you put in place that you have to use certain standards, or how do you solve this particular challenge?
Thank you. This is a good question. So in the end, language is it's a challenge. Standards for sure are our challenge. But the thing is, we have experience in some other projects using OMOP for data exploiting data. But we are not planning any standard in particular. So we will get the idea from the industry, to provide solutions. So in any standard they consider appropriate for the project. But we don't have any standard in mind right now. So, but I agree with you. So in the end, when you develop something, so you have to take care about the language you will use in order to speak to another systems. Thank you.
Thank you, Jonathan. Yeah, we have another question here. And then we will conclude this session.
First, thank you very much, because it was very interesting to hear you. I have a question regarding the process, because normally when you build a great software, you iterate, like every 2 weeks you change probably the software. I come from the software industry, not properly healthcare, but basically you iterate every 2 weeks, and that makes great software. So my question would be how we can use this methodology to healthcare to build great healthcare for you and for your project.
Good question. How will you work, Joan? You want to understand?
In our case, the main objective is integration. So the most important thing is to establish the requirements for this integration. So standards for the medical equipment and standards also for the departmental information system. So this is the main issue that you have to take into account.
And Jonathan, if I'm correct, in the PCP process, you have this iteration work as well with the users, with different phases where you can exchange and reiterate and rechange. Not every 2 weeks, I don't think so. But there is this go and forth with the users and the buyers to develop the solution, no? The different phases you propose. So the PCP is specifically as well on that. Okay, do we have other questions? No? So I will thank you all very much. Thank you very much. We can upload the speakers of this last session.